Hi, welcome to this week's edition of Scrub Talk. Today we are featuring Mark Randell, Director of Outpatient Operations and Post-Acute Care here for the hospital. Thanks for joining me.
Thank you.
So we have this thing here called swing bed. It's not a new concept, but it's something that we're using a lot more lately.
We're allowing patients that need extended care, extended rehab, to stay for an extended period of time in the hospital setting where they have access to physicians and APPs, rehab folks, nursing. So they can be quite acute and have this extensive service available to them. And they can stay here for an extended period of time, do their rehabilitation and get them to the highest level of functioning so that they can go home safely.
So I know that traditionally we would have, we were governed for a certain length of stay for patients. This actually allows them to extend that length of stay so that they can have those resources that you talked about here in the hospital. So what are the advantages then?
So some of the advantages I already mentioned is we have a physician or an APP on staff 24/7. We have nursing here on staff 24/7. So having that safety net is a big advantage to the patient. They get extensive rehab where they're getting rehab at least 5 days a week. They can practice activities of daily living, so how are they going to acclimate back to the home? So they're getting all those services here, and it's close to their home, it's close to their support system, their families.
And one of the great things that I notice is that when we send patients to UP Health System Marquette, I know you've been working really hard on getting them back.
Right, and it's for the patients, so the patients can again get back here where their family support system is, so that they can get the care in a safe environment and be close to where their support network is.
Yeah, 24/7 physician coverage, 24/7 nurse coverage. I absolutely love. We were just watching someone hang laundry.
Yeah.
Something as simple as that. I know that we have a washer and dryer now that they're using to make sure that they optimize their functional capacity.
Right, so they need, when they leave here, they need to be able to do those activities.
Yeah.
So they need to learn how to do them here safely. Balance can be an issue. It may be the cognition piece of being able to do the steps. So yes, we want to emulate what it's like when they go home. So we do that by having a washing machine here. We're actually hanging clothes in this setting.
That's great. And historically, what would we do with these patients? We wouldn't send them home to fail.
So historically, these patients would probably end up in a nursing home. So it's similar type of level of care, but it can be done here in the hospital.
Yeah. Well, and that's great because I know that if we're able to keep them here a little bit longer and transition them home safely in an optimal state of health, that's far better than giving them to another place and then have to transition them the second time to their home. So I thank you for all the work that you're doing. I know this is a relatively new program that we're really getting off the ground, but it's been a great success. I think we have 10 total swing beds that we can use, and I think there's like 8 in-house today. So that's a lot of hard work that you're putting in. So thank you so much for everything you do.
Thank you.
And thank you guys for tuning in this week, and we'll see you guys next week on Scrub Talk.